Hello, hello. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. We are the largest IC support group in the world with about 50,000 members. And it is time for another live IC bladder, prostate, pelvic pain support group meeting. Now, this is a drop-in meeting. This is not a regularly scheduled meeting because I kind of screwed up my meeting last Sunday. And so I owe you guys another meeting. And so I thought I would drop in today and let's just chat about IC and take your questions. Now, my purpose in doing these meetings is to make you, hi Sherry, so strong, so informed, so powerful that no one can ever mess with you. That is my goal. Unlike 20 years ago, 15 years ago, 10 years ago, 5 years ago, even maybe last year, even maybe this year, some of you have been told that IC is all in your head. It is absolutely not all in your head. It is real, it is treatable, and we certainly are no longer going to paint very broad strokes about it. I want you all to understand that we no longer think of quote unquote interstitial cystitis as an incurable bladder disease. We don't. We have variants. So my job is to educate you, empower you, inform you, and give you the information and tools and skills that you need so that you can really take charge of your medical care. Now, of course, I'm not a doctor. I cannot give you medical advice. My job is to hopefully tell you where to look next. Now, what's so interesting as a support group leader, I've been a support group leader now for 25 years. And there are so many interesting people you meet when you run support groups. Like I just earlier, about an hour ago, was talking with one of my favorite ever people, who is an older lady down in the South who has really struggled with doctors who have not been respecting her over the years. And so whenever you run a support group, you've got newbies, you've got people coming here because they want hope. They want encouragement. They want information. And then you've got grizzled veterans who come to meeting who need a place to vent. They need a place to say how bad it is. And, putting them two in the same room is really hard because we don't want people who are not doing well to scare the people who are doing well, especially again, now that we have subtypes, because now we know why some patients don't do well. And we can't say that your story is going to apply to the newbie story and vice versa, right? And that's really one of the challenge of online support groups is we see God, how do I even say this? There's this perception that what's happening to Jill is going to happen to me. What's happening to Heather is going to happen to me. You know what? What if you're completely different subtypes? Her experience isn't going to be your experience. That's why we no longer say IC is an incurable bladder disease, because you know what? Some of you have pelvic floor issues. Some of you might have fibroids. The lead story for our winter IC Optimist, which is almost done, is actually on fibroids, which is interesting, and how patients can be quote unquote cured of their urinary symptoms, quite a few patients, when the fibroid is addressed. Okay. But there are also patients who will come to meetings over and over and over, and they will ask the same question over and over and over. And they will call me. And it's like I spend an hour with them on the phone, explaining diet, explaining the subtypes, and then they call me back a month later and with exactly the same question. And it's like, wait a second, I know we talked about this. And then they call again a month later with exactly the same question. It's like, no, wait. I have talked to you for over 2-3 hours. I've said these things. Do you not remember those conversations? And those are the patients that kind of inspire these support group meetings, because really in those patients, they don't want to do the work. They don't. They want to be told what to do so that they can just do it. They don't want to invest in knowledge. They don't want to invest in information. They don't want to invest in the time it takes to really understand why you might be having pain and what you can do. We kind of see the same thing with patients who keep asking for medicine. Like you call the doctor and you say, can you just please give me something? I don't care. Just give me something, for God's sake, make it go away. Well, if your problem is a muscle issue, then taking Elmeron makes no sense. Taking an antibiotic makes no sense. And so this kind of quick, I don't care what you just give me something, is again not going to get you where I want you to be, which is understanding why you're having pain and the therapies and the strategies that might help you with that pain. So when I think of those patients, I'm like going, okay, I'm going to give them half of the information, and then I'm going to tell them where to get the next half. Because if I give it to them all, they won't invest. And so as you watch these support group meetings and you hear me say stuff, I don't want you necessarily, I mean, you can, I hope that you believe me, but I want you to credibility check me. For God's sake, go read the freaking article. Research it, Google it. Don't do it in a Facebook support group. You're not going to get good quality information in a Facebook support group. But like, go to the National Library of Medicine, come to our website, go to the ICA website, read about it, read about the subtypes, read about pain management, read about pelvic floor dysfunction. So my job is to give you the information, give you the core fundamental information, then to kick you in the butt and tell you, go there, because I need you to invest too. I hope that kind of makes sense, right? I hope it does. I want to take a moment and thank our sponsor for our support group meetings for this year, which is Preleaf, DSC Healthcare Solutions, and makers of Preleaf. They have been the first sponsor to come on board to help us run and stream these meetings. I'm doing it right now on a brand new computer. Woohoo! My old computer, I have I'm sitting in front of two iMacs, is about 4 years old, and it's just starting to be a little bit unpredictable. So to have a brand new computer to be able to do this on is good. So if you're ever going to be going somewhere where you think you might be exposed to a food that could irritate you, going out to a restaurant, going to a birthday party, a friend's house, come on, try some Preleaf. It might help. You should not take Preleaf if you're prone to calcium-based kidney stones, because it is a calcium product. And also, please don't take it like candy. Some of you do. Some of you carry it around, just pop it. Please don't do that. We don't want you to do anything like that, okay? You need to be firm and directed with respect to how you're doing it, okay? So I do these support group meetings in 3 sections. I usually do a little educational information first, and then I'll take your questions for as long as you have questions. Sometimes it's up to 2 hours. I've even gone 3 hours. And then usually somewhere in there, I'm going to throw away a giveaway. I don't really have an educational thing for today, except I want to talk about our emotional health, because I'm an IC patient like you, and I go through periods where I have a tremendous amount of, it's not bitterness. I'm not bitter anymore, but I have regrets. I regret that when I was in my 20s, I had really bad irritable bowel syndrome that made dating really hard. I still remember going out with one of my dearest friends, a guy who had actually proposed to me at one point in time, and he's still a very, very dear friend. And I couldn't enjoy the moment because I had an IBS attack 30 minutes after the meal. And so when I'm working with IC patients, I see reflections of myself, because we're all human. And for those of us who have had some of these symptoms for many years, for me, my first symptoms began in 7th grade. I'm now in my 50s. It's been a lifetime dominated by a variety of health issues. And, when I woke up this morning, I had like that thought of, look at that. You don't have children. And I will tell you that is like a dagger in my heart. When I was young, I thought I would have 5 children. The number 5 was in my brain for a decade. You're going to have 5 children, Jill Osborne, and one of them's going to be a little redheaded girl, and you're going to walk into your mom's front door with her in your hand. And I was robbed of that. Throw in now, I don't have a uterus anyway because of early uterine cancer, and it really, really came home. And it's really easy to get lost in the bitterness, to get lost in the regret, is to get lost in the past. And as I try to cope with my life and what's happened with my life, um, this is what I know. I can't change that. I cannot change my genetics. I cannot change that every woman in my family, going back generations, has a sensitive bladder, has a sensitive vulva, has a sensitive bowel. We are the epitome of IC subtype 5. It is how I was born. It is not my fault. And it is very important that I say that to myself, even though, guys, like I consider myself really well adjusted. I mean, I'm really well adjusted with this. And yet there are moments when it just like slaps me on the side of the face. It's like, you don't have kids? What the fuck is wrong with you? I'm sorry. God, you know what? I'm so sorry because I'm swearing in some of these meetings. I apologize. Please don't think worse of me because I do that. I try so hard not to, but bam, every now and then it pops out. But that's a real thing. Like, what the hell is wrong with you, Jill? Come on. Why weren't you able to fulfill the dream that you and your girlfriends had? And all I can do is I can go back to genetics. It is genetics. It is like the woman who inherits fibroids and loses her uterus. It's all that sort of stuff, right? And so there are some of you who are lost in the past. I'm not lost in the past. It's like every now and then for like 5 minutes, bam, it hits me. Maybe, I don't know, once a month, once every 2 weeks, where it's just really powerful grief. But I've trained myself to say, I cannot change the past. God has me here for a reason. There's something that I'm supposed to be doing. And that's what I say to some of you who have exactly that same emotion. I don't know why this has happened to you at this point in time. There could be genetics, it could be a traumatic incident. It could have been a fall in high school. It could have been an injury that happened before you even remember having it. But I don't want you to spend any more than a minute or two in your life thinking about it. It's over. The past is behind you. Whatever the hell happened, it's long gone. You could spend months and years blaming people for this. It will never get you where you need to be. I've got a one IC patient who absolutely insists it's her mother's fault. She's completely, whenever you talk to her, the anger is so big. She's been out of her mom's house for 40 years. Okay? What you have control of, what we have control of is today, at this very moment. What can you do right now to put your bladder and to put your body and to put your spirit in a better place? And thinking about the past is a lost opportunity. In fact, another friend of mine, where is it? Where did I put it? Darn it. He said yesterday, I was kind of having a moment yesterday, right? Where just, really tired. I wasn't sleeping well haven't been sleeping well for the last couple of weeks. Not for my IC, just bad habits more than anything else. And he said to me, you will miss 100% of the shots that you don't take. You'll miss 100% of the shots you don't take. And if you're spending time on the past, you're not thinking about the shots, the things that you can do right now that can help you, like calling the doctor, making an appointment, like calling the physical therapist, going to physical therapy, like stopping what you're doing, getting your rollerball, going into your living room and working on your pelvic floor. And so I my goal in bringing this up right now is to show you that I'm just like you and I have the same thoughts that you guys have. But it's so important that you forgive yourself, and it's so important that you forgive. I can't blame my parents for this because they inherited it. I can't blame my grandparents for this because they freaking inherited it. I don't want to blame anybody anymore. I don't want to carry any bitterness anymore. I don't want to carry any grief anymore. I want to have a happy day. And I want to do anything I can today to make sure that tomorrow is a good day, not only for me, but for the people around me. And so that is my wish for you. And that is my hope for you, is that you can, when you catch yourself thinking of the what ifs and the should haves and the could haves, stop yourself and just say, wait a second. What can I do at this very moment to feel better? Can I go make a cup of hot chamomile tea that will calm and soothe my bladder? Can I take a medicine I haven't taken? Can I get outside? Can I go take a walk? Can I call a friend? You have power at this moment to make yourself feel comfort. Do it. Do it. Okay? The past is over. The future hasn't happened. What you have control of right now is today. And so I want you to take the power of today. Alrighty? That's all I'm going to say. I'm ready. Let's just talk about IC, people. I'm ready to talk about IC. I'm feeling good. I'm feeling better today than I was on Sunday. So if you were here on Sunday, you would know that I was not at my best. Kristen says, so happy to see you. My pelvic floor is spasming today. I'm in bed and having to self-cath. So Kristen, are you using a muscle relaxant or have you done your pelvic floor relaxation? I know that when my pelvic floor was spasming after my hysterectomy, that's when I whipped out my glass wand and I inserted that so carefully with a little bit of KY into my vagina and very, very gently calmed those muscles down. So I hope you're doing something besides laying in bed. I hope that you're stretching, relaxing, doing your meditation, having a cup of chamomile herbal tea, if you have a vaginal Valium suppository, use that. If you got an oral medication like baclofen or Flexeril, that would help calm those spasms. Go for it, my dear. Go for it. Heat. Taking a hot shower. In fact, at the AUA class on IC, which I talk about, and I won't be able to go this year. Well, I don't know. The next AUA class is in Chicago in May. I don't know if I'm going to want to fly there. I hate flying with a passion. Like seriously, when you have IC, right? It doesn't matter if your bladder's full. You always have to pee when you're on a plane. I have a strategy for traveling. Okay. So like my strategy number one is whenever I call and make a reservation, I always tell them I have a disability. Okay. The second thing I do is I want a bathroom. I want a seat right next to the bathroom. I don't care where the bathroom is in the plane. I want to be within a row of that. If it's at the back end of the plane, I'm happy at the back of the plane. I just close my eyes because I can't look up the row because I see the plane going up and down and up and down. That kind of freaks me out a little bit. So I just keep reading something. If I'm on the very, very back of the plane, being the front of the plane is better. But anyway, so number one, I let them know I have a disability. Number two, I always ask for a seat right next to the bathroom as close as possible, preferably on the aisle. Number three, when I get on the plane, I immediately introduce myself to the flight attendant and let them know I have a disability. I have a bladder issue. It can be very, very painful. And to please help me if I'm in a situation where I need to use the restroom. And 9 times out of 10, they're totally good with that. Every now and then you get a prick of a flight attendant, whoever that might be, who looks at you and goes, you don't look sick. You don't need any help. It's like, yeah. Wait until it happens to you. Okay, I could swear there, but I won't. And the funniest story that ever happened is I was on a plane, and during the literally the first 45 minutes, I was flying from Orlando to California, I think after an AUA meeting. My knee had fallen into the aisle, right? I mean, my legs were just kind of slightly open because I was trying to get comfortable. And the flight attendant came along with the big cart. And she bam my knee, like really hard. And she immediately freaked out because she thought she broke my knee, right? And I was like, it just bounced off. It wasn't that big of a deal to me. And she's like, oh my God, are you okay? Are you okay? And I'm like, yeah, I'm okay. She goes, is there anything I can do to help you? Can I get you anything, a drink? And I just looked at her and I said, yeah. If I need to use the restroom, would you please let me use the restroom? She goes, I got you and got your back. And that entire flight, I was gold. So, you know, where there's a will, there's a way, right? Okay, so anyway, in this class, this year's class, AUA, oh, let me see. The very first thing that they said, hold on a sec. So Dr. Robert Muldoon is a doctor who taught this section on pelvic floor dysfunction. And you know what? I'm just going to read you the summary of what he said for this. Dr. Muldoon took some time to discuss the care of patients with pelvic floor dysfunction. He explained that when a patient is suffering from pain, the pelvic floor muscles tighten and can go into spasm. This then worsens the pain, making it difficult to urinate, causing poor urinary flow, constipation, and makes sex more painful. Patients then strain, which causes yet more tightening of the muscles, which of course triggers more pain. Patients get stuck in an infinite pain muscle tension loop. And of course, high levels of stress also trigger muscle tension, worsening symptoms, etc. 75% of patients have urinary hesitancy. They cannot start their stream quickly. 75% have a decreased stream. 73% cannot completely empty their bladder. 70% strain to urinate. 68% struggle with constipation. 45% have pain with sexual intercourse. 43% have low back pain. And remarkably, 24% of these patients also have a history of urethral dilation. And I had about 100 urethral dilations as a kid. Pelvic floor dysfunction is often misdiagnosed as UTI, overactive bladder, prostatitis, IC, endometriosis, fibroids. He recommends that patients take warm baths twice daily using Aveeno. Aveeno makes a really good soothing bath powder. He said that patients should be instructed to not push or strain with urination, not to do squats when working out. Skeletal muscle relaxants may be used, but most importantly, physical therapy should be attempted. Trigger points can be treated with using dry needling or injectable lidocaine, Botox, or bupivacaine. All righty? Okay. Jill on Facebook, and guys on YouTube, feel free to ask questions. Here, I just have to open up my window a little bit more so I can see your questions. Hey, Donna on YouTube, you won a prize on Sunday, but you didn't give me your address, my friend. I cannot send you a prize if you don't tell me where to send it and or tell me what you want. So Donna, if you could email me, icnetwork@mac.com, and the giveaway on Sunday was an item of your choice out of the IC Network store underneath $50. So you can have any of the supplements, heating pads, chair cushions, anything like that, Donna. So if you could, icnetwork@mac.com, please let me know what you want. All right. All right, Jill on Facebook says she needs to email on chemotherapy in ICU. Just started day 5 in intense bladder pain. All right. So Jill, number one, I wish I could give you a hug right now. I'm so sorry that you're going through chemo. I faced it myself a year and a half ago. And girl, be strong. Know that you've got a group of IC brothers and sisters standing by you. If we can help you in any way that we can do that, I will do that. You're welcome to call me at any time. Let me tell you, the reason why chemotherapy is irritating is because the chemicals in the chemo, when they are metabolized, are broken down into some pretty irritating substances. That's why we call it chemo-induced cystitis. And this is something that I've been talking with clinicians about for 25 years. And what they all say is, try a protective coating. Use a protective coating in your bladder for the duration of the chemo to kind of create an extra barrier, right? So here's a three-dimensional picture of the bladder. And normally we have a nice thick coating of mucus that protects the urothelial cells and then the blood vessels and nerves. But chemo it is very caustic and aggressive to this mucus. So generally what they would say is try Elmeron, try a coating and get that coating in there as quickly as can, because think about it as another layer of a protective coating. Also, in the meantime, understand that because your bladder is going to be uber sensitive and fragile, it's very important that you follow the diet right now. No coffee, no green tea, no black tea. You're probably going to want a little bit of soda if you're dealing with the nausea. If you are, use something like Pre-Leaf to try to reduce the acid. An old-fashioned root beer has the least acid and usually is not caffeinated. That would be the one that I would suggest that you try. Use your pain medicine. If your bladder's screaming, make sure that you tell them it's screaming. That's the time when they will usually give you some pain medicine. Learn to stay ahead of the pain with little tiny bits of pain medicine over time. And so that's what I got for you. But if you want, feel free to give me a phone call and we can brainstorm a little bit more. And I would be happy to make some inquiries for you if I can do that for you. Okay. Now, guys, if you're on Facebook, please know that your questions scroll by really quickly. And if I miss it, please feel free to ask it again. Amanda says a lot of IC symptoms are in our diet. And, I'm going to agree with you. I'm absolutely going to agree with you. I think our diet is so corrupted right now. It's stunning to me. It's stunning to me. The level of foods that are contaminated with pesticides, with preservatives, with strong acids, all in the search of making a buck for those companies to make a buck. And I don't think they care what they do. I don't think they care if their product is going to hurt somebody. Man, their goal, think about Mountain Dew. Mountain Dew is just should never be on the market. It's so high in caffeine and so high in acid. Now, I don't know if you remember years ago, Dateline did a big expose on Mountain Dew in Appalachia, and it turned out that Mountain Dew is cheaper than milk. And so for a very, very poor family, they are buying Mountain Dew. And they were actually obviously they were not particularly educated, giving Mountain Dew to infants. And infants, as their teeth were growing out black with cavities. And that's a product, in my opinion, that should not be on a market. It just is what it is. All right, Whitney, I have IC and I can no longer afford my Elmeron due to work going. Okay, Elmeron's $8.22. I couldn't pick it up. Yes. And I wish I could screen share right now. I can't screen share yet. When we move over to Twitch, I will be able to screen share. They actually talked about that at the American Urology Association conference. And I actually put the slide up on that from last June on our Facebook page. If you scroll back to last May or last June, what the doctor said is alternatives to Elmeron are, in fact, supplements, specifically Cysto Renew, Desert Harvest Aloe, Cysto Protect, Desert Harvest Aloe, or Cysto Renew. These would be the three supplements that are believed to have a bit of a coating effect that could be swapped in for Elmeron if you cannot afford Elmeron. And $8.22 is cheap compared to some patients having to pay $2,000 for a prescription. Who can afford $2,000, much less $800? I couldn't afford $800 a month for a medicine. It's ridiculous, absolutely ridiculous. We have to be very thankful that we actually have supplements that cost under $50 a month, and thankful of those doctors like Dr. Theoharides, who is an IC researcher who invented Cysto Protect 20 years ago, and that is still one of the most popular supplements out there. And you know what, guys? If you didn't watch it's hot in here. For winter, it's hot. If you did not watch my meeting on Sunday, I have terrible news. Terrible, infuriating news for the IC patient community. And that is that Lyris is the only treatment that has ever healed Hunner's lesions after 2 weeks of treatment. Lyris has been, quote, deprioritized by Allergan. So what does that mean? Well, I sent the director, I think it's the director of clinical affairs who told me this after sending email over and over again. What does that mean? What it means is that the company is shifting to other products that have the potential to make them more money. Deprioritize basically means it's pretty much shut down. So it is a great tragedy that this has happened, because it is the first treatment in history that has healed Hunner's lesions. And now it is apparently abandoned. So let me tell you what I did last night, aside from reading pharmaceutical marketing articles to really try to understand the context of the word deprioritized. Hold on a sec. I'm just going to my other computer here. I went back to the company that invented Lyris, Taris, Taris. And the original contacts that I had 6 years ago before Allergan bought it from them, the original people that I worked with are no longer there, but I actually sent an email to their clinical director, and I was just wondering if that person had emailed me back. Let me look here. Hold on a sec. Let me just search my email. I get tons of email here, so. No, okay, I haven't heard back yet. So what I did do is I went back to Taris and I sent them an email and I said, hey, Allergan's deprioritized it. Is there any way that you guys can take up the cause for interstitial cystitis again? And so cross your fingers. I did go over there. So Lyris is a real revolution in the care of bladder issues, because the ultimate problem with having any sort of bladder issue is, how do you get medicine in there to stay in there? Because the problem with putting any medicine in the bladder is you pee it out, right? And as many of you know, I mean, seriously, holding a bladder installation 20 minutes is tough. Holding a bladder installation for an hour or 2 hours, almost impossible, especially if you got a painful bladder. So it was researchers at MIT who took the challenge on of how can we deliver medicine 24 hours a day to the bladder? And what they did is they created a soft, hollow tube, like a piece of spaghetti that you can fill with medicine, and you insert it into the bladder, and it kind of crumples up like a pretzel so it won't come back out, and you fill it with medicine. And so the first study was with lidocaine, and they did it as a treatment for bladder pain. And they were stunned in their very first clinical trial to find out that it healed Hunner's lesions. And eventually, to make a very long story short, Allergan, the behemoth big pharma, Allergan bought it 5 or 6 years ago because they thought it was a good profit-making opportunity. Taris retained the technology, though, and they're actually using they're doing clinical trials right now with overactive bladder, and I think it was Trospaz. So they're putting an overactive bladder medicine in it and putting that in a patient's bladder for 2 weeks. And I think they're at phase 2 trials. I was looking at it last night. So anyway, what I'm hoping that we're going to do is embark on a campaign to I refuse to beg, I refuse to plead to Allergan, anything like that. But I think we want to embark on a letter writing campaign to the board of directors, seeing if we can get them to take up the cause. I don't want you to do that on your own. I need to formulate that myself, but I will come back to that. So for those of you who kept asking about Lyris, it is the worst news. But I'm already making inquiries, seeing if we can get somebody else to pick it up. Alrighty. He calls me his own on YouTube. What a great name. Is there any other way to get a protective coating back? I got severely damaged from IC. Thank you so much. I eat all organic and had food. Well, hon, you got to remember that the coating is estrogen dependent. So this coating is really estrogen dependent. So when you're young and you have a lot of estrogen, you have a lot of protective coating or mucus. When you're older, you have less estrogen, you have less mucus. So really kind of the number one way to try to help your body produce more coating is to use a topical estrogen vaginally. And that will be taken up through into your bladder, through your vaginal wall, and it will help your bladder produce more mucus. You can look up genitourinary syndrome of menopause. That's what they talk about. That would be the number one thing that we would be doing. Always remember too that healing is always happening. It's not like healing ever stops in the human body. If you fell and skinned your knee, you'd have a scab on it tomorrow. Your body is trying right now to fix whatever the heck is going on. And so it's very important that you don't interfere with the healing process. So seriously, so here is a wounded bladder. So you can see the mucus is getting through, the irritants in your urine is getting through the mucus down to these cells. So here's a wound, right? Now, when one of these this cell right here, these are umbrella cells. These are the largest single cells in the human body, these giant cells right here. If you looked at them under an electron microscope, they look like a beehive. They're hexagonal. They're fascinating. Because these are the largest single cells in the human body, it takes the longest to replace them. So imagine a pepperoni, a giant pizza. It doesn't matter, pepperoni, just a big giant pizza, right? And imagine a little tiny pea underneath that pizza. So that pizza is this giant umbrella cell. The pea is the little tiny stem cell that is destined to become the next umbrella cell. But it takes 2 weeks for that pea to grow in size, change shape, and fill in this process. And I learned that from a lecture by Dr. Anthony Schaefer, who's somewhere in Chicago at a National Institutes of Health event years ago, right? So here we've got these giant cells. It takes about 2 weeks for it to be replaced. So imagine you have a wound here. You've got a little tiny cell trying to fix it. What do you think is going to happen if you pour coffee on it? You're going to kill it. That's why if you pour soda on an open wound, if you have open wound on your hand, you pour soda on it, what's going to happen to that wound? You're going to wash away the scab. You're going to wash away the new cells that are trying to fix it. And the odds are, if you keep pouring acid on that wound every day, that wound is going to get bigger. And that's exactly what we also think happens with the bladder is you have a wound. You don't even know you have a wound. You're drinking coffee every day or soda every day. You're bathing that wound in acid. And what Dr. Schaefer says is that stem cell that's trying to heal that spot is exquisitely vulnerable to acid, that literally that one soda is going to kill it. So then that sets you back another 2 weeks, and then another 2 weeks, and then another 2 weeks. And that's why we all agree that the patients who suffer the most are the patients who drink one coffee or one soda a day, because your bladder cannot heal with that. So your job is to create an environment to support healing. Emily said she started healing when she forgave herself for subjecting herself to surgery she should have never had. You carried a lot of anger, but your doctor told you to let that go. Made the best decision I could have in the moment. It's so interesting how, we get consumed by frustration. I work with my local, I'm actually a vice president of our local grange. We're trying to restore a grange, which is an agricultural community. And I've been very angry for the last 2 weeks with a certain person over there. And it's just I just kind of have to stop myself. It's like, come on now, a year from now, this is going to be meaningless. And there's no reason to what do they call it? Ruminate. When you can't stop yourself from thinking about something, it's ruminating. You catch yourself ruminating over and over about whatever. And you really have to try to stop yourself from doing that. I used to ruminate about the employer who fired me when I was out on disability and I lost my health insurance. And so much to the point that I sued them. And then I ruminated about them for 5 years until it was over. You know, you got to remember, guys, a lawsuit isn't about the truth. It's about who has the most money to support the lie they want to share. That's all I'm going to say about a lawsuit. Don't do it. Even if you're right, like me, it's a disability lawsuit. It was right. It was justice. In the end, was it worth 5 years of my life? Hell no, it was not. Fiona says, good morning. I've just started with pelvic floor physio, and although it's painful, it's helping. Awesome. Congratulations, Fiona. Erin, what about traveling in IC? You're so nervous to travel. Girl, listen, if you're traveling in a car, you got to carry travel johns. We sell them in our store. They're little plastic bags with a hard plastic cover. You put it between your legs, you pee into it, right? If you're, you know, half the battle with traveling is you just don't know, you just worry that you're not going to have access to a restroom, right? But if you've got a portable restroom in your car, you'll never use it. But just knowing you have it takes so much of the stress away. So I have travel johns in my car, and I also have a pop-up tent in my car. We used to sell them on the IC network about 20 years ago. We sold them for about 5 years. You can buy them on Amazon. Because I once got stuck on the Golden Gate Bridge in traffic for an hour and my bladder was screaming. Anyway, pop-up tent, you pull over the side of the road, you unzip it, it literally pops up. It's what models change in on shoots. Step in, grab your travel john, pee into it, fold it up, step out, collapse your tent. 2 minutes later, you're back in your car and nobody's the wiser. Or you open the front door, you open the back door. Hopefully you're on a hill, you're facing a hillside and nobody can see you because you got doors blocking you if you need to pee. Or what I did before we had travel johns is I had a garbage bag that I put towels in. And I figured that if I ever needed it, I would just pull over, get into the back seat, plop my tushy down onto these towels, pee into the towels, pull it up, wrap it in plastic, throw it in the trash can, right? You know, but the point here is if you already have it in the car, then it takes all the worry away. And the odds are I have never had to use it in 25 years. Never. But just knowing it's there is so incredible. I also have some videos on our website and traveling on IC and how to deal with planes and all that sort of stuff. And so watch those videos. They're over in our Living with IC video area. Rita says, what good advice flying, going to Hawaii, leaving on Monday for a flight of 8 hours? So, all right. So, Rita, this is what I do. I pre-medicate. I know for me, the stress of the flight is going to make me need to pee more. It's not a bladder wall flare. It's a stress flare. Odds are the night before I'm going to have an IBS attack and a flare, and I'm going to be miserable that morning. Okay. That's just the way I work. That's the way my body's been for 40 years. But that doesn't stop me. So what I do about an hour before I'm supposed to leave the house, I take my first quarter of a Flexeril to relax my pelvic floor. And I will take my first quarter of a Norco if it's going to be a long flight, right? I take quarters. And then I will do that every 2 hours for the duration of the trip or as needed. But the point is, I'm ahead of it before I even leave. And the most important of those really is the muscle relaxant, because you can keep those muscles relaxed and not have that pelvic floor flare from being on the bus, going to the airport or whatever. That's really, really important. The next thing is when you're on the plane. All right. So they're boarding, right? So they're boarding the plane. Okay. And let's say you're the third group. So when group number 2 comes along and they call them up, for God's sake, go pee. Right? Then you're going to board. And now you're going to do your strategy thing. All right, I'm going to pee before we take off. When am I going to do it? And so just as the last couple of people come on, run to the bathroom and pee again. Just get in there, right? And then hopefully now you've come back, everybody's settling down, they're starting to move the plane, and you're going to take off. As soon as you hit altitude and as soon as they take that sign off, go to the bathroom again. And just that's at the point where when you need to go, go. Just go. Make sure you're drinking, don't drink a lot of water. I mean, that's kind of where you're screwed, because if you're taking a long flight, you're going to be dehydrated. We don't want you to be dehydrated because that concentrates your urine. So make sure you're drinking bottled water. Don't drink alcohol or anything like that. Just stick with your bottled water. Bring some icy friendly snacks. I usually bring yogurt covered raisins. That's what I do, which is weird. And then the next challenge, so you're going to get up once an hour for the next 6 hours, and that's fine. Don't freak about it. Enjoy the movie, bring games, whatever. I just try to get lost in whatever I'm writing. Read a romance novel, read a book, watch a movie, whatever. Then the last step is when do you pee before you're ready to land? And as you can feel when the plane starts to drop down. And as soon as you feel the plane moving steadily down and you're like 45 minutes away from landing, get up and pee again. And then just know that when you get off the plane, you're going to stop at the first bathroom and pee again. And then you're done. And you're going to have a great time. Hey, listen, one thing about Hawaii, though, I just want to warn you about Hawaii. I have family that lives there. I've been there many times. I actually, personally, it's not my favorite place to go anymore. Make sure you have to understand that if you're on Honolulu, if you're in Honolulu, on Oahu, they have a sewage problem in their ocean water. And you make sure if you're staying at a hotel, you ask the concierge, are there any warnings about active sewage, any bacterial contamination in the water? Because if there are, you're not going to want to go into the water above your knees. It's one of the dirty secrets of Hawaii that they don't want tourists to know, because they're afraid you won't come to visit. But it is real, and it happened to me. I went. Why did I go? I had to go see my aunt and uncle, and I went with my mom. Anyway, I had this wicked IC flare in the plane. Hadn't even been diagnosed with IC then, but my bladder was screaming. I didn't know anything. That doesn't relate. I mean, I was drinking coffee and soda and all that sort of stuff. Anyway, I was at Kaiser, the hospital, the next day in Honolulu, and I had this sweet little Japanese doctor who could barely speak English, and she said, go water, go water. And I was like, what? I'm in Hawaii. I want to go in the water. She goes, no, trust me, don't go in the water. And so for 2 weeks, I did not go in the water above my knees until the last day, when I did go to Hanauma Bay and went snorkeling. And I woke up the next morning and the room was spinning because I had a sewage-borne virus in my ears. And when we called the emergency room, I had to crawl down 2 flights of stairs to my parents to get help. When we called the emergency room, they go, yeah, you're a 20th one. It happens every day. It's just the sewage in the water. Okay. So just ask first to make sure it's okay. Okay, hun. If it's fine, great. But if there are any warnings about it, do not go in the water, stay in the pool. Gigi says, are there IC safe exercises? Yes. Any exercise that keeps your hips level. I have a video on it on our website. We don't want you doing Stairmaster. We don't want you maybe running, doing anything that's like this. We want you to do things where your hips are level. Stairmaster. Not Stairmaster, elliptical, rowing, walking, stuff like that. If you got pelvic floor issues, you got to be careful with lifting. Doing weights can be a bit of a mistake. You definitely want to talk with your physical therapist about it. Hey guys, one of my favorite people is online right now in our meeting, Atara Shamil. Atara Shamil is the most amazing artist. And she made some things that we, gosh, you know what? I don't know if I can turn. Can you see these in the background? This beautiful woman, we will be heard, believe in your healing, practice compassion for yourself. Incredible art series. Look at that. That proves that a pelvic pain patient can do beautiful, beautiful things. And you can buy those cards right in our store. They're the ones I send out to people who call and ask for help. Rocio is running bad for IC because I have the intention of training for a 42K. Was already training with the 21K back in October when you got injured. You know, hon, it depends upon the health of your pelvic floor. You know, speaking as a former athlete myself, there comes a point in time where sometimes your workouts are a little hard on your body. You know that we're not young anymore; we're older, and our bodies are not necessarily as resilient as they used to be. And so you're really going to have to listen to your body and listen to your pelvic floor, hun, and see what happens there. Michelle says you would not believe the acidic pH in bottled water. Yeah, it can happen. Miranda, how do you get doctors to listen to you and the pain that you're in? My bladder is screaming and I'm not sure what I should do at this point. You know, Miranda, I always tell patients you are an anatomical mystery to be solved. I think the worst thing you can do is go in and say you have IC. I think your ability to be very, very specific with your symptoms is incredibly important. So I would rather that you go into the doctor and say, I am here to figure out why I am having this symptom. Why does this hurt when I do this? So I was working with a patient today who her pain only happens when she pees. She gets a very sharp, searing pain whenever she's passing urine. As soon as she's done, it goes away. It just goes away, which is very unusual for an IC patient. I don't believe that she's an IC patient. And so rather than dropping down the rabbit hole of IC, what I want you to do is I want you to write out your symptoms and be as specific as you can be and pay attention to the weird little ones that you might not tell anybody, like a fluttering sensation, a vibration, or when you do this, this happens, or when you do this, that happens. Try to get as specific as you can. What I don't want you to do is say, I've got pain down there. That doesn't mean anything to the doctor. I need you to say, is your pain internal? Is it external? Is it low? Is it high? Is it deep in your body? Is it shallow in your body? Is it to the left? Is it to the right? What does it feel like? Is it sharp? Is it electrical? Is it dull? Is it burning? Okay, those are all meaningful, important tips that will help your doctor understand what you are going through. What else would I do in that situation? What makes it better? What makes it worse? Do you feel good when you wake up? Do you feel bad when you wake up? What do you turn to when it hurts so bad? Like, do you take a hot shower? Do you use a heating pad? If heat makes it feel better, that kind of points to muscles and tight muscles. So I have some videos on our website that talk about how to deal with a doctor that doesn't believe you. So come on over to the IC Network and watch those videos. And I think that you would find them very helpful. As I pull out my slides. Come on over to ic-network.com and check out my Living with IC video series. And you'll find two or three videos that talk about this a little bit more. And listen, if you want to brainstorm before your appointment, come in with some questions, feel free to call me. I'd be happy to help you brainstorm and most of all, give you a pep talk, because of anything else, remember, this is not your fault. You've done absolutely nothing wrong. Judy. Oh, Judy Taylor has a very, very important question. And that is, What is our opinion on Interstim? Any opinion on Interstim, which my urologist wants to implant? All right. One of my favorite questions ever, ever, ever. So Interstim uses, oh, you know what? Is something shining here? Oh, hold on a sec. It's weird. Is that better? Okay. Interstim was invented at UC San Francisco back in the late 1980s. I know this because I was a patient at UC San Francisco in the early 1993, 1994. The theory behind Interstim is that the nerves in the pelvis are dysfunctional. And if we re-regulate them with a mild electronic impulse, perhaps that will help them function more effectively. And so the intention of Interstim was certainly honorable. It was absolutely honorable. However, very, very early on, they had issues with it. I know this because I was the support group leader here in Northern California for it, and I had many Interstim patients in our support group meeting bawling their eyes out. Or in the early days, the box was big, the units were big, the wires moved around. You would have your trial. They wouldn't use anesthesia. You bent over to get in the car. The wires would move. It would be rendered neutral within minutes, yada, yada, yada. The early days of Interstim were very, very ugly. Today, Interstim was acquired from UC San Francisco and Dr. Richard Schmidt, the doctor who invented it, and it is now owned by Medtronic. And obviously, Medtronic has absolutely done massive redesigns of the product. The product is now much smaller. The leads stay in place because they have little tines in it, and we now know that we can place the leads in different spots. We can place the leads in the pudendal area, or we can place them higher in the sacral area. However, there is one constant with Interstim that has been the case from day one, and that is side effects. There are really significant side effects with Interstim, so much to the point that there are hundreds and hundreds and hundreds and hundreds of them reported to the US FDA MAUDE database, MAUDE database. And I'm just going to go there right now. Hold on a sec. And let's just look at, hold on. Let's take a look at, I can spell MAUDE right, the last 20 or so adverse events. So hold on a sec. I'm now at the MAUDE database. It's called the Manufacturer and User Facility Device Experience. I am typing in brand name Interstim. The thing with this database is you got to look at the dates. Right now, it's only selecting January of 2019. Okay, so I'm just doing Interstim. I'm leaving everything else blank. We're just going to go to the last month. I don't know if anything was filed in the last month. Let's see what we find. Let's see here. Holy hell. Wow. Okay. Yeah, there's a lot. 3 pages, and they put up 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 30 reports of adverse events filed on between January 31st and 30th. Okay, so it's like literally 10 or 20 adverse events reported a day with Interstim. So let me actually look at the last report that was filed. Let's see if it will let me do it. That's interesting. Hold on. Hold on. Maybe hold on. Let me do this a different way. This is important, guys. This is really, really important because, you know, doctors like to recommend Interstim. Number one, it's Medicare approved. Number two, it's a great money-making opportunity for the doctor because it is surgery. They like doing surgery. They like the money they make from the surgery. And they're not necessarily up to date on the complications. They might say to you, yeah, we use it all the time. Patients do really well. But the question is are they telling you? I'm actually opening this up in a different browser, so give me a second. Are they telling you the facts? Are they telling you the types of complications that they're seeing? And the odds are they may not even know. Yeah, they might be pretty good themselves, but I think it's important that you, as a patient, understand what the risks are. All right, so here it is. I got it open. So here's the last thing filed. Information was received from the consumer regarding a patient with an implantable InterStim for urinary dysfunction, sacral nerve stimulation, as well as pelvic floor. It was reported that the patient had issues with their neck. It was also reported that the programmer was dead as a doornail, but the patient was able to get the remote working again. However, there were poor communication icons. The patient wanted to call their healthcare professional and ended the report. In the end, it was the device doesn't work. All right, let's go to the next one. Okay, so here's this information was received from a manufacturer representative. So this is a sales rep for InterStim regarding a patient who was implanted with InterStim for urinary dysfunction. It was reported that the patient was unable to increase stimulation when they tried to use their programmer. Patient stated that it was possible that they accidentally pressed the wrong button, but to their knowledge, they never used the off button. Patient turned on the device and decided the stimulation was too high. Okay. Let's keep going. I'm curious. Here's a patient who got a loaner programmer until they received their replacement programmer. And it might have been damaged by a CAT scan. Patient says she had a CAT scan where the healthcare professional found one of the leads was laying on a nerve and causing the patient back pain. All right. So when you spend any time reading these, it's like this. It just sucks me in. See what's happening with these. I forgot what I was saying there. Okay. So when you spend time going through these, there are some very common patterns. The most common side effect to InterStim is MRSA infections, deep tissue MRSA infections. And that is in all likelihood because there are a lot of E. coli and a lot of other staph infections, all sorts of bacteria, basically on your tush, on your butt. And that's where they do some of the surgery. And so question number one is, can you actually get rid of all the bacteria on the skin before the surgery? And many people are saying, not really. The second complication with InterStim is that the device itself can malfunction. You can get shocks. We had one patient who got a shock every single time she had a bowel movement, and her doctor told her that was normal. And I went, no, hell no, that is not normal. You call the company immediately. The company said, no, that is absolutely not normal. And they referred her to another doctor to get it fixed. The tragedy are the fatalities that have been reported. The last time I went through them, and know that there are hundreds and hundreds of them, I haven't been through them in maybe 2 or 3 years. I found 20 fatalities associated with InterStim, and they were filed as fatalities associated with InterStim. And in every single case, the FDA had on that message additional information requested, but they never reported back what they found. But we do know that for some patients, InterStim changed heart rhythms. And I once challenged with a doctor who is a friend of mine, who's an outstanding InterStim doctor. And I said to him, what do you have to say about the fatalities reported with InterStim to the FDA? And it's kind of a deer in a headlight moment because he really wasn't aware of the fatalities, but there are fatalities. So InterStim is a step 4 treatment option. Okay, so the theory here is you should have at least done everything in step 1 through step 3. And then in step 4, you have options. InterStim would be the last option because at UC San Francisco, when InterStim was created, there was another doctor, Dr. Marshall Stoller, who was appalled by what he was seeing with InterStim. He said, you don't need to do surgery to access this nerve. You can access this nerve at the closest, where it's the closest to the surface of the skin, which happens to be above the ankle bone. And I was very blessed that when I was referred to UC San Francisco, I ended up in his clinic rather than the InterStim clinic. And this is known as a post-tibial nerve stimulation, or the Stoller afferent nerve stimulator, or today under the brand name Urgent PC. So what they do instead, rather than doing an incision at your lower spine and putting a box in your butt, a pacemaker unit in your tush or by your hip, they just insert an acupuncture needle to this nerve about a 1/2 inch to 1 inch deep, attach a TENS unit to it, and re-regulate the nerve that way. And I had it done, and I was one of the early patients, and I think I can show you my tattoo. I'm wearing one of my crazy leggings today. Okay. I don't think you can see it. I don't know if you can see, there's a little black spot right there. It's 3 inches. So here's my ankle bone. It's 3 inches above the ankle bone, but it's not midline. It's below midline. And the needle does not go in straight. The needle has to be you kind of move it down 30 degrees and towards you 30 degrees to actually access the nerve correctly. You know you've accessed the nerve correctly if when they turn it on, your big toe bends down or your little toes flex out. If none of that happens, the stimulator is not in the correct position. So ankle stim is far safer with respect to adverse events than InterStim. They're both approved by Medicare for exact same reason, frequency, urgency. They're not approved for pain management. The other big issue is finances. Ankle stim will cost a couple $1,000s potentially, but it might be covered by insurance. InterStim requires not one, but at least 2 surgeries, possibly 3. The first surgery to implant the electrode, the second surgery to implant the box, and the third surgery to remove them when they don't work anymore. So every time you go into the hospital, you're incurring hospital fees. And also if they have to replace the unit. So let me just tell you one other story about InterStim that's very, very important. We had a nurse, and I think she was like in Virginia or something. There were only 3 urologists in her town. She'd seen all of them. They all pretty much said, we're not going to treat you until you have InterStim. So she felt forced into it. But she was a nurse, right? And so she, I'm just kind of adjusting this light. She decided, I mean, at least she had some knowledge here, right? She had some knowledge. She at least thought she knew what she should do. So, and money was tight for her. So what'd she do? She talked to the accountant at the doctor's office and said, is this covered by my insurance? The billing person said, absolutely covered by your insurance. No advance approval necessary. She then called the hospital where she worked, called the billing department. Is InterStim covered by my insurance? They said, yes, absolutely. No written pre-approval is necessary. Then she went over the top and she called her insurance company and said, is this covered by my health insurance? They said, absolutely covered. No written pre-approval is necessary. She agreed to have the surgery. A week later, she had a bill for $80,000 and a threat to garnish her wages because guess what? It wasn't covered. The mistake she made is she didn't get any of it in writing. So make sure you get it in writing. Make sure you get from your insurance company and from your doctor that it is completely covered. Because if it is not completely covered, you're not going to be able to afford it. And is it worth the risk when compared to doing something that might just cost a couple $1,000s? All right. So that's your long answer on InterStem, my friends. Jody, you're thinking of Cystoprotect or Cystorenew. Cystoprotect or Cystorenew. One or the other, there's no way to tell which one is going to work for you. Most patients are starting with Cystorenew right now because it has 4 potential ways of helping your bladder. Both of these are grounded with chondroitin and quercetin. Chondroitin has a bladder coating effect. Quercetin has an antihistaminic effect. This also has a little bit of sodium hyaluronate, which also has, they believe, a bladder coating effect. But it's an old formula. It's a formula from 20 years ago created by Dr. Theorides. We've learned a lot about IC since then. And he's moved on. He's working with autism now. He's not working with IC patients. And so a new doctor, Dr. Gio Espinosa, who actually was in our last live lecture on Sunday, he came to visit. He's the one who invented Cystorenew. And it really is a better formula because there are 4 ways that it can help you. So it has the 2 same ingredients, chondroitin and quercetin, but this also has a little bit of aloe in it for the soothing effect of aloe, combined with lemon balm. And this is not citrus lemon. This is a mint with a lemony scent, lemon balm. And lemon balm is known for calming and soothing nerves. And then it also has some L-arginine and some L-citrulline in it. Okay, so most people are choosing to try this one first. The only really exception is people who are aloe intolerant. There are some people who have gut issues when they take aloe. And if you're one of those patients, you're not going to be able to do this. You're going to go back to this. I will be shortly. We have a new supplement that's very exciting. And I've got a couple of, at least one of the top IC doctors in the world has been working on it with us. I've been helping too. And they are now doing some preliminary testing in their clinics with this new supplement. I think it's going to be the best one yet. We already have a couple, at least one patient who is completely refractive to any therapy who has been taking it now, I think, for a week to 10 days, and she's doing wonderfully. So stay tuned. When the new supplement is available, we will let you know because I'm pretty excited about it. Alrighty. It's approaching it from a very, very different perspective. But it's using some of the same things, but a few more things. I can't say more until I've been given permission to explain it all. All right. All right. Crystal says, my feeling like I need to pee feeling, that frequency urgency feeling is always one-sided. In her case, it's on the left side. Is this a normal? No, that's not. That's pelvic floor, hun. That's usually pelvic floor. If you know, so remember, okay, you get to see my crazy leggings, right? Okay. So here's the top of my legs. So your bladder is really right here. And so bladder-centric pain is going to be right literally above your pubes, all the way up maybe kind of in this area. Anything to the left of center or to the right of center, we're going to really look at pelvic floor. Or fibroid. Do you have fibroids on the left side? That's something that it is, I mean, it's something we always knew about, but it's resonating more with us now, with me particularly. So one thing you could do is try pushing, so again, okay, so here's my hip bone right here, right? Hold on. So my hip bone is right there. Try pushing gently right on the inside of that hip bone. Not hard, gently. See, that hurts for me. It's very tight for me because I have left-sided pelvic floor dysfunction. So if you have pain on the inside of your hip bones, that really, see, like, I mean, it's kind of like one of those, I don't know. I mean, it's not a hurt so good, hurt so bad feeling, but it's like a muscle knot, like you just want to rub it. See, I'm sweating doing that because that's where we're working on my pelvic floor right now. It's just right in that area. All right, it's not letting me scroll back. I'm sorry. Is ICE subtype 5 the only heredity IC subtype? Yes, that we have so far. Is it worth or not worth fighting for disability? Yeah, hell, girl, come on now. Listen, disability insurance is, if you're applying for Social Security disability, you paid out of your paycheck for the right for that insurance. It's not as a certain individual likes to say, it's not what's the right word? It's not a handout. Social Security disability is an insurance program that you have been paying a premium for out of your health insurance, out of your paycheck. So you damn well keep fighting. Come on, don't give up. Don't give up. You're, my first job after college was working for Social Security for a year before I went to grad school. And it was a pit. I got to tell you, it was a real pit to work in. But you have to understand that there are so many applications that one of their strategies is to just tire you out. So the vast majority of applications are, I mean, I don't mean vast majority. I don't remember the exact figure, and I don't know what it is today, but it's well over 90% of applications were denied first time around. And they're kind of praying that you'll give up. So don't give up. Fight. I have a story on our website from a lady who fought so long. She got all the way up to the highest court that she could get into, which was a federal appeals court. And she won. And what happened to her is she applied and she was denied over and over because they said that there was no proof that she had frequency. And that the doctor did not witness her frequency. And as a result, they said there was no proof or evidence that she had frequency. And she appealed, got all the way up to the federal court, and the federal court just killed Social Security and said, it is impossible for a doctor to witness frequency. What would have prevented that, though, is if she'd had a voiding diary. So if you're going through the process of thinking about applying for disability, make sure you do a voiding diary. And every time you have a doctor's appointment, bring a 5-day voiding diary and get into your medical record. That is really good proof and evidence of your frequency. Alexa says, I would like to know what your best advice for IC and cancer. I've recently been diagnosed with breast cancer. Oh, hon, I'm so sorry. Oh, big giant hug. I'm so sorry. Okay, well, number one, remember that you've got lots of people here who are sending you their love and their support and their kindness and courage. I went through this 2 years ago myself, but with uterine cancer, I know how you probably feel like you're shattered right now. Lots of deep breaths, positive thinking. Remember that we don't know yet. You don't know yet. So let's not, I don't know. I'm not saying that right, hun. I'm not saying that right. But with respect to preparing, I got through 2 emergency surgeries, and I have full confidence that you're going to handle whatever happens to you in your life, that you will get through this, uh, um, because you are, that's the one thing about an IC patient you got to remember. We are hella strong. We are some of the strongest people you ever meet because we know what it's like to be in pain, and we have worked through it. And I think you're going to be good with whatever surgery happens. But what we got to do is protect your bladder if you happen to need some chemo. And so we talked about that earlier with somebody else. Usually that's putting in a bladder coating. But I would really look at your diet. I would really spend a lot of time reading about how to reduce inflammation, reducing sugars in your diet, reducing carbs in your diet, or the high sugar carbs. I would really start diving into nutritional approaches to cancer as well, to see if there's some changes that you can make there that would also help your body promote some healing. If there's anything that I can do to help you, please don't hesitate to ask. Doctors are a little bit cavalier, oncologists are a little bit cavalier about the effects of chemo on the bladder. They don't necessarily understand what interstitial cystitis is, but we can give you some information that you can take to them that will help you make sure that they focus on protecting your bladder at all costs. Usually that means beginning a bladder coating about a week or two, or maybe even a month before starting any chemo. But I am sending you so much love and so much strength, and hold on, girl. Hold on. One day at a time, 1 minute at a time, one step at a time. Fill your life with sunshine, open the windows, get out in the sun, fill your days with laughter, and just know that you can handle this obstacle. You are going to fight through this obstacle and get to the other side, okay? Gigi was talking about Zumba with her IC. Yeah, Zumba's pretty aggressive. I've never done it myself. I'm older now. I'm now understanding a menopausal pelvic floor because a sneeze is a little different now. I can't imagine jumping up and down. Ramona says she's had her InterStim with no problems. I do understand how there can be. Good to hear that you've been doing so well, Ramona. You should be at the point now where they might be considering battery change, though. Miranda says her InterStim, her 3 leads have broken. I want this thing out of me. Hun, that's one of the other issues that I have with the company and with some doctors is sometimes they'll refuse to take it out of you unless there's a problem. And I have a big issue with that. I mean, if it's not working and if you have broken leads, I think it's really important to get that metal out of your body, because if you happen to be in a car accident and you need an MRI or CAT scan, they might not be able to do that with that device in there. And so this is where you get issues with insurance coverage and doctors and things like that. But generally, the longer the device is in, the harder it is to remove it. And so it's important that you get it removed fairly quickly, because what happens is tissue grows over the leads and they kind of lock in place. And then sometimes doctors have no choice. They just cut the leads and leave the little leads in your body. And that's not ideal. Ramona, you say you've read everything you can about InterStim. I hope you've come on over to our website and read. We have 4 discussion boards on neuromodulation. We've got considering it, trying it, successes and failures. I think it's really important to read the failure board and the success board. You need both sides. Cindy had her InterStim removed because her white blood cell count rose to 19,000. And upon removal, it went back to normal. That's the issue, is that really the dominant issue with InterStim are these really deep in drug-resistant infections, MRSA staph infections. So it doesn't surprise me at all. And I really, really hope that you filed a report with the FDA MOD database to let them know that that happened to you. That's a really significant side effect that should be reported. Melissa says you got the InterStim is scary, but you can't go back. Honey, I don't want you to be scared. You just need to be knowledgeable and informed. I mean, it's working for you. If it's working for you, power to you. Just be on top of it if anything happens. If you start getting shocked, man, you got to call your doctor right away. But as long as it's working, you're in good shape. You just have to be really proactive with InterStim, okay? You don't just wait. You know, you want it checked by your doctor fairly regularly. What about Botox? Is Botox done in the operating room? Yes, it is, because they usually have to do a hydrodistension to do it. Harry, do many men have IC and are interested? Do many men get InterStim? I don't think we have a research study that correlates sex, but yes, absolutely. We work with men all the time. I work with men personally. It's kind of my specialty. Is I really love working with men struggling with this because I really think that you're underserved. Yeah, I know we like to say that women don't necessarily get the best of care at times, but I will tell you, men with pelvic pain also get crap care. And because they're kind of condemned to a diagnosis of chronic prostatitis. They're given antibiotics forever. Then they're given prostate medications. And in the end, we find out, at least in my experience, the vast majority of men that I'm working with usually have some sort of pelvic injury, Harry. Paratrooper, Ironman athlete, NFL football player, high school athlete, bike rider, motorcycle rider. We can usually go back in time in their case and find some sort of pelvic trauma. And it usually points us, in fact, to long-term muscle dysfunction, muscle weakness. Alicia, oh, I am so happy. Alicia says she's had IC for 13 years, been a chronic pain patient for years. I kept her bedridden. Then she started taking elderberry syrup 2 months ago for the flu, and your pain and urgency went away, and it's still working. Also taking freeze-dried aloe through the capsule, which is probably this. I'm so happy for you, hun. I'm so happy for you. Now listen, protect yourself, protect your bladder. Don't go crazy with your diet. You are living proof that healing happens. Everybody watching this, look at her story. She was in pain for 13 years to the point that she was almost bedridden, and now she is pain-free. That's fascinating, and it's important, and it happens all the time. The question is, to me, the most interesting point is trying to figure out what was triggering the pain in the first place. I was doing a lot of elderberry gummy bears in January. Laura Phoenix, are there any supplements that can help with nerve pain? A lemon balm. The one that I'm the most familiar with is lemon balm. Lemon balm is known for kind of calming and soothing nerves, so it might be interesting to try. Stephanie, a new urologist suggested cranberry concentrate pills. No, no, that would be a no. Yeah, no, 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 no. Okay. So several people are saying here you have pain on one side, burning. Remember, burning is a sign of muscle tension. Muscles that are working hard build up lactic acid, and lactic acid burns. That's why if you were to go run around the block, your leg muscles would start burning because they're working hard. Tight pelvic floor muscles are working hard. They're building up lactic acid that causes burning. So for all of you with one-sided, now guys, remember, anybody being diagnosed with IC today, your very first appointment, you should have a pelvic floor assessment. And if that pelvic floor shows tight muscles, your next stop is to a pelvic floor physical therapist for a proper pelvic floor workup. Amanda says, can you get to the point? This video is taking too long. Sorry, girl. This is me. Alicia, my pain and burning moves from the urethra to the rectum. Is that normal? It can because it can for two reasons. Number one, you've got muscles that go from front to back, left to right, low to high. So you could have a muscle that's tight by your urethra that is then going to your rectum or vice versa. Usually the levator ani muscle would be the muscle that I would suspect in that. But it also could be a little bit of the nerves getting irritated. Alexis says her pain stems on the right top of her bladder. The pressure sometimes gets so painful. So, Alexis, the other thing I really think you need to check out is there any chance you have a fibroid pushing on your bladder on that spot? That is a possibility. You know, generally, most IC patients cannot point to a spot. Most IC patients have just pain in their bladder, but it's generalized pain, it's diffuse pain. Anytime you can point to a spot, that spot needs to be explored. What is that spot? Is there a Hunner's lesion there? Maybe. Is there an adhesion there? Maybe. Is there a fibroid pushing on it there? Maybe. Is there a leftover suture from a hysterectomy or surgery there? Maybe. That's why I tell patients, don't go in and say you have IC. You're going to go in and say, I had pain in this exact spot every single time. Please tell me about that spot. And that way you don't drop down the rabbit hole of IC with their belief structure. You are an anatomical mystery to be solved. That spot right on the top of your bladder. What the hell is it? Cindy Halsey, your pain is where you urinate. It burns all the time. No TUTI, diagnosed with IC 2008, instills pelvic floor, everything else. Is there something else this could be? It's almost like it is in your urethra. Hun, I've got an article on our website called The 7 Causes of Urethral Burn. So if you can go on over to the IC network and Google urethra or search for urethra or urethral, just search for urethra on our website, check that blog. So just go to IC Network. It could be several things there. The most notably are going to be estrogen atrophy. The urethra is kind of like the canary in the coal mine. It's the first part of the urinary tract that's going to react to the loss of estrogen. So many women with urethral pain, myself included, it gets right back to estrogen atrophy from getting older. It's shocking to be older. Number 2, infection, chronic infection, or infection in the periurethral gland. Number 3, chemical sensitivity. If you are washing your underwear in Tide with a fabric softener and or a dryer sheet, you're putting a lot of chemicals on that's staying in your underwear that's then being exposed to your tender skin and your urethra. And there are other things like that. So look at that blog, The 7 Causes of Urethral Irritation. Sue, you too. Crystal says she's having symptoms that are stimulated by bowel movement. So again, we're looking at muscles. Dottie says her pelvic pain specialist says her urethral pain is pelvic floor. It can be pelvic floor. It can be estrogen atrophy. Again, go to our website and look at that blog, The 7 Causes of Urethral Pain. I'm checking down here on YouTube here for a moment. I'm seeing discussions about estrogen atrophy over here on YouTube. Andrea says, even inserting estradiol or vaginal lubricant bothers and creates irritation. Somebody's asking about Cymbalta. Cymbalta is one of this kind of class of painkillers that has gotten more popular in the last 5 to 10 years. Unfortunately, there are some medications when you start them, it's very hard to get off of them. And Cymbalta is one of them. It causes something called discontinuation syndrome, Cymbalta discontinuation syndrome. And actually, it can cause hallucinations. It's very, and gosh, come on, this weekend in the paper, what was it? There was another medication that was causing terrible discontinuation, and it was an over the counter. Oh, I know what it was. It was the antihistamine. Crap. Oh, stunning. Hold on. OTC antihistamines. I want to get it. I think it was Zyrtec. Yeah, I think that's what it was. Zyrtec. Discontinuation. Was it? What? Yeah. Is that it? Yeah, that's it. So Zyrtec. Oh, you know what? I was going to do a consumer announcement on our website. For those of you who do, antihistamines are a very common therapy for calming bladder irritation in the bladder wall. And normally we use hydroxyzine pamoate, also known as Vistaril, or hydroxyzine hydrochloride, also known as Atarax. Some of you have gone to over-the-counter antihistamines like Zyrtec. It turns out, though, that Zyrtec has now been associated with extreme itching, unbearable, agonizing itching in people who try to get off of Zyrtec. And it's kind of here it is, quitting Zyrtec is total hell. If you're on Zyrtec and you're thinking that you want to get off, you really need to Google it first, talk to the pharmacist about it, because for some people, it causes just agonizing itching for a couple of months. And you want to learn from other patients like that. Let me write this down real quick. I gotta have my Post-its all over the place telling me what I need to do. Alicia, do public pools bother your IC? Public pools have been known to bother patients with IC, usually because of the chemical irritation. Last summer, the Center for Disease Control finally released a comprehensive report of chemical-induced injuries from pools. There were, I think, well over 1,000 people who were harmed by chemicals, and that is indeed what happened to me when I experienced bladder pain for the first time, was after a chemical mistake in a swimming pool that I was training in. Harry says, your insurance turned you down for Interstem? Well, Harry, you know what? I mean, look at Urgent PC. See if they'll do Urgent PC. It's much cheaper. Insurance companies are trying to save money. Interstem costs a lot of money. Urgent PC, ankle stem does not cost a lot of money. Also, I have a blog on pool safety. We did a big article on it in our magazine last year on our website for those interested in pools and the experience that patients have with pools. Harry, chronic anemia. No, we don't really see a connection between IC and chronic anemia unless patients have bleeding Hunner's lesions. If you've got Hunner's lesions that bleed, then chronic anemia can make sense. Most people do not have chronic anemia. Melissa says her pain hurts so badly when it's cold outside. That's because cold is a stressor. Cold, extreme weather changes are stressors on the human body. And when it's cold, your muscles get tight. When it's warm, your muscles tend to relax. So odds are you're having a muscle tension from that cold, but it could just be stress in general. Alicia says, "Is a doctor in California the only one doing it?" No, no, no. There are doctors all over the country and world doing urgent PC. Just Google urgent PC. Go to their website, and they have a doctor finder. Stephanie is scheduled for an InterStim trial next week. Your doctor says it will help with pain. You're hearing from others that it doesn't help. InterStim is not approved for pain. Period. It is not approved for pain. Yes, there are some patients who reported help with pain, but there are many others who were disappointed that it did not help with pain. They are supposed to tell you that it is not approved for pelvic pain or pain management. And as you can see here, we've got some people in here that it helps their pain, and for others, it does nothing for their pain. Lisa Marie, is there a way to differentiate between infections and flares? Mine is a constant burning that often feels like infection. Yes, my dear, a UTI test strip. Azo, urinary test strips. Go down to Walgreens, go down to your CVS, buy some test strips. That's a way to do it. Now, a test strips, these test strips have two. Okay, so here's my demo. And no, I'm not going to, I love to demo things, but I'm not going to pee on it. It would be. Is it in here? No, it's not in here. Okay. So here's what it looks like. You just start peeing, put that in there, and you've got two tabs at the end, two little pads on the end. The top one is for leukocytes. The bottom one is for nitrites. The odds are, if you're having a bladder flare, you're going to have leukocytes, but you're not going to have nitrites. Nitrites are only produced by bacteria. So if you have what I call a double positive, you've got pink on the bottom and purple on the top, you have infection. If you have it clear on the bottom and purple on the top, your bladder is irritated and injured. And it's weeping some blood cells, but that doesn't necessarily mean there's infection. I could explain that, but I won't explain why that happens unless somebody asks. Is it normal to have urethral burning after having a bowel movement or getting a shower? It's just on what feels like the outside. Yeah, it would go away after a few minutes or an hour. That's where my flares occur. So what you're saying here is your pain is external, not internal. It's anytime you've got burning after urination. If you have burning on your skin, if your urine feels hot while you're peeing, that's estrogen atrophy. That means your skin, the health of your skin is poor. And your skin, the odds are your skin there does not have a lot of protective coating. So urine is reaching the skin in your urethra and causing irritation. So that would be the number one thing that we would look for. The other thing that we would potentially look for, though, is, are you straining? Are you straining when, well, okay, actually getting back to the estrogen atrophy, you say that you have burning after you take a shower. Are you using a soap? If you've got dry skin and you put soap on it like Dial, like the lady I was working with a couple hours ago, yeah, Dial's going to burn like hell. The only soap you should be using is a plain Dove bar. Not even Dove liquid. A plain, simple Dove bar is the best for people with sensitive skin, okay? I guess we could also look at muscle. but I don't know why muscles would flare while you're taking a shower. But the burning after number 2, I mean, it's either estrogen atrophy or muscle. Are you straining when you're having a poop? I mean, if you're pushing hard, you could be triggering a pelvic floor. I guess the question is your pain internal or external? If it's external, it's probably estrogen atrophy. If it's internal, it could be estrogen atrophy in your urethra, or maybe it could be pelvic floor. Those would be the 2 most obvious things, I think. Rebecca says she suffers from chronic UTI embedded in her bladder wall, proven by tests, mainly urethral pain. I'm deficient in vitamin B12, folic acid, ferritin, and D. Since treating these deficiencies about a month ago, my UTI pain has eased a lot. Good. I mean, it's really very interesting how as we get older, we develop some vitamin deficiencies. I also was very deficient in B12 and vitamin D. And they found that, I'm going to say, 8 or 9 years ago, and I have been treating it religiously, and I'm way better than I was. So I take B12 and I take D, and I will take a multivitamin maybe once a week. I don't believe in taking vitamins every day, and I will do our multi-right low acid vitamin. I have flared every time I've tried a Centrum or a 1 a day because they use cheap high acid vitamin C. But when you get a product like this, it is deliberately low acid, it might be better for you. But that's a good point. The vitamin deficiencies are fascinating. And I have to write that down too. I'm working on a project. I'm working on a really interesting project, and that's something I need to include in there. Sarah says she has very bad pain at the end of your period, burning when you urinate, and continued urethral pain. So, some people feel worse before their period. Some people feel worse after their period. It's sometimes there's kind of no rhyme or reason to it. The question is it internal or external? Burning when you urinate are you burning inside your urethra, or are you burning on your skin outside of your urethra? If it's that, then it means your estrogen levels are getting a little funky. Jane said she was on Cymbalta and had discontinuation syndrome. She had to wean herself off. You got brain zaps and hot flashes. Yeah, that's what I remember patients telling us like 5 years ago when we first covered it. It was the brain zaps that were challenging. Sue, how do people get off of Cymbalta? You're going to need to Google it. The challenge with some of these medications is, and I don't remember the exact dose for Cymbalta, but let's just say the lowest dose of Cymbalta is 20 milligrams. And if you can't cut it in half, then you can't go from 20 to 15 to 10 to 5. And usually it's a very, very gradual process. But some medications, the manufacturer does not make a lower dose. And that's been a point of contention here. So you'll have to Google it, talk to your pharmacist about it. Is Cymbalta an antidepressant? I don't remember. Veronica, is hydroxyzine okay for IC? Hell yeah. Hydroxyzine is very commonly prescribed for IC and is mentioned in the American Urology Association guidelines for IC. Comes in 2 forms: hydroxyzine hydrochloride, also known as Atarax, hydroxyzine pamoate, also known as Vistaril. Of the 2, the pamoate is better tolerated. The Vistaril is better tolerated. The hydroxyzine hydrochloride, it comes in a lot of generic forms, and unfortunately, the generics tend to have a lot of other ingredients in that can be more irritating. I know I took 1 Atarax and I knew I couldn't take it. I don't remember what it did. I knew I could not take it. I switched over to the Vistaril with no problems. Took it for 10 years. I love the medication. The only reason I stopped hydroxyzine is because it started giving me night terrors. And that's what it does. We call it hydroxyzine dreams. It can make your dreams very vivid. It took a long time for that to happen to me, though. But when I finally started having night terrors, it was terrible. I was dreaming about watching my family be eviscerated. They were terrible, or my cat being tortured. And as soon as I stopped the medication, they stopped immediately. So that was a good lesson for me. Miranda, does menopause cause IC symptoms to be worse? I'm 26 and going through premenopause caused by early well, what menopause does is it reduces your estrogen levels, and what that means then is that your bladder cannot produce this nice thick coating like it used to have, right? Because this top coating, this mucosal barrier, is estrogen dependent. So what's going to happen is your skin is going to get drier, both your skin, your face, but your bits, your tender bits. So they're going to become more sensitive because they just don't have a lot of mucus. So using a topical estrogen cream I would assume at your age, they've given you something, and using a topical estrogen cream could help tremendously. The advantage of a topical estrogen as compared to an oral estrogen is it tends to stay in the tissue, and it does not become systemic to the point that you could raise your risk for breast cancer or uterine. Well, you can't have uterine cancer because you had a hysterectomy like I did. But anyway, make sure you talk to your doctor about your symptoms. And, I don't know when you had your hysterectomy, but it's a beast to recover from. I mean, I'm 18 months and I'm still recovering from it. There's a physical recovery and there's an emotional recovery. And then there's just a trauma recovery. It's traumatic to go through. It is a traumatic experience. And it's hard to, I don't want to say it changes you, but it changes your perspective going through something like that. I mean, there's definitely, it's hard. If you want to talk about it, I'm a fellow hysterectomy survivor, Miranda. Please feel free to give me a phone call. Hey guys, listen, if you find this helpful, would you please make sure that you like this Facebook page or you subscribe to our YouTube channel? And if you could, please tell your friends about it. Please post about it. If you're on Facebook, post it to your personal pages and let other people watch, or your IC groups. That would be so awesome. Meg is asking us, has a low testosterone level ever been associated with frequency urgency? Not that I'm aware of, but we're certainly seeing weird hormonal connections in a small group of patients. Sean says, has IC vulvodynia lichen sclerosis found a medication that helps vulvodynia called Intrarosa? I've never heard of Intrarosa. Let's see what it is. Hold on a sec. I'm on a different keyboard. Prasterone. That's interesting. Prasterone, vaginal insert. The only vaginal non-estrogen treatment for moderate to severe painful sex due to menopause. Well, what the hell is it? What is it? Choose Intrarosa. It's a prasterone, a synthetic form of a substance your body produces naturally. Oh, called DHEA. I have no clue. I have absolutely no clue, hun. With respect to if that will do anything to your IC. Any advice dealing with the insurance company? Google, you'd be amazed. Google for coupons. A lot of companies have coupons that they don't advertise. There are drug assistance programs. Let's see here. On their website, look, they have talk online to a healthcare provider about intrarosa. Tell them that financially you're challenged and you cannot afford it, and ask if they have a drug assistance program or a coupon. Just go for it. Be bold, and mighty forces shall come to thy aid. I say, ask the question. Why the heck not? Jesse, what is good for pain? Any suggestions, hon? It all depends upon the type of pain you're having. Are you having bladder wall pain from a Hunter's lesion? Are you having pelvic pain from striated muscle of your pelvic floor? Are you having pain from smooth muscle of your bladder wall? Is your pain internal? Is your pain external? It all begins with the type of pain you're having before we can answer that question. Veronica, can macrobid irritate your bladder? Yeah, honey, any antibiotic has the potential of irritating your bladder. Augmentin is brutal on the bladder. Sarah says she has no IC symptoms during her period, but she has urethral burning inside and out. So Sarah, again, estrogen atrophy, that's what I'd be looking at. But please go to our website, read that blog, The 7 Causes of Urethral Irritation. Lydia says, what about bladder spasms? Any tips? Yeah, an antispasmodic, ditropan. Oxybutynin is very good at calming bladder spasms. Sean, wondering about the night terrors. Yeah, that's the reason why you're going to stop taking hydroxyzine. The thing about hydroxyzine and hydroxyzine dreams is if you're having a good dream, like a sex dream, it becomes the best sex of your life. Oh my God, dream. I mean, it's incredible. But if you're having a nightmare, it becomes a night terror, and they are terrible. So hydroxyzine really influences dreaming states. And once you're at the night terror state, that's your time. That's your body saying it's time to stop, in my opinion. Lisa asking if anybody takes meds for sleep. Every now and then. Our phone number is right on our website. Just go to our website, icy-network.com. We are a real company with an about us and a contact page where you can actually reach out to us. So icy-network.com. Guys, we've been a support group for 25 years. We are the largest support group in the world. With about 50,000 members, and we're rated #1 in 2 peer-reviewed medical research studies, one by Harvard Medical School and the other one by the University of London, for our website. It's the most accurate, reliable, and credible website on IC. So I hope you will come over to our website and sign up for our free newsletter. I send out just 1 newsletter a month or 2. There's no spam. I don't spam. And when you sign up for our newsletter, you get, as a gift, our 40-page flare management guide. So it is a good thing. We give you something for signing up, which is a really good flare management guide, which will help you differentiate between a bladder wall flare versus a pelvic flare versus a hormone flare. And then we give you hour-by-hour rescue strategies for each type of flare. So come on over to the IC Network. A pop-up window will come up in about 30 seconds. Put your email address in, sign up for it. You can unsubscribe at any time, but you can absolutely download that flare guide. I'm going to be rewriting that. And we are in the process of rewriting our diet. If I could just freaking find the time to do it. It's so busy right now. 2019 was supposed to be an easy year. It's a hard year. There's so much work to do. Sean says the intro rose has rebuilt the mucus of the vaginal wall and cleared the lichen completely. That is incredible. All right. It is on my list here of things to dive into. Thank you for educating me. Dottie, does any of you know the connection between IC, pelvic floor dysfunction, and restless leg? When my bladder is irritated, my legs go crazy. Urination calms them slightly. I don't. The only thing I can, I just have to wonder, is your IC, is it all about very tight pelvic floor muscles? And when your muscles are getting really tight and spasming, is it causing your legs to also spasm? I don't have any experience with restless leg syndrome, I'm sorry to say. Cheryl, is it normal for your urine to change smell when you're changing your diet to cut out acidic foods? Yeah. But Google it. The Mayo Clinic has a really good page. In fact, I just looked at it like last week on what the smell of your urine means, because it's so weird. You can tell. You can tell you've eaten asparagus by how your urine smells. So there are all sorts of. Anyway, Alexa says, are there any good IC books? Yeah, hold on, let me go. I have all the old ones and all the new ones here in my. Darn it. All right, well, that was to be expected. Hold on, I'm getting the good books. Stay. Okay. Hold on. Hey, man. All right. You want to know the good books for IC? Let me give you the lowdown on the good books for IC. Okay. The book that is the newest book is called The Interstitial Cystitis Solution by Nicole Kozian. She's a physical therapist in Southern California. She was the 2018 Physical Therapist of the Year. What makes this book so good is it's the first book which really clearly explains the connection between the bladder and the pelvic floor. And so if you're looking for a basic book, this is a book to get. A couple of things in here that I think she would rewrite if she could. She and I had a little discussion afterwards. Does not talk about the subtyping or anything like that, but good basic information in this book. So this would be your starter book. If you want information on the IC diet, oh man, you're going to do A Taste of the Good Life, a cookbook for an IC diet. Bev Lauman, the author of this, is working on her second edition after 15 years. She's brilliant. I cannot wait. Or you can do the Confident Choices books. This is written by Julie Beyer. I don't know if Julie's in here, but Julie Beyer is the first registered dietitian to ever work with IC patients. Or you could do this is the book that I edited. This is the most recent diet book called the IC Chef Cookbook. And this not only has our diet list, but it also has lots and lots of recipes submitted by IC patients, okay? So we've got the IC diet books, the Taste of the Good Life, Confident Choices, or this. If you are looking for a book on pain management, this is the book you're going to get, When It Hurts Down There. Fabulous, fabulous book. This is brand new. I did a big interview with Dr. Storr, the author. She's an OBGYN down in Texas in our last magazine, in the IC Optimist. So you can get the Optimist and you can read that magazine. If You are struggling with pelvic floor dysfunction. You are going to either get this one, Ending Female Pelvic Pain by Isa Herrera. She's she does a lot of stuff on Facebook, as a matter of fact. Ending Male Pelvic Pain by Isa Herrera. Fabulous book. Really the best book for men on pelvic floor issues, in my opinion. Or Heal Pelvic Pain by Amy Stein, also a physical therapist. This is for men and women. Okay. Donna on YouTube's going, I have that book, and I have that book, and I have that book, and that was my first Icy book. Okay. The newest book that's going to be coming out is going to be the second edition of this one, The Proactive Patient by Gay and Andrew Sandler. Unfortunately, the publisher of this book went out of business, and so it went out of print. For you old timers, you probably remember the book Patient to Patient Managing IC and Related Conditions. I have it in my bookshelf. That was a fabulous book on IC about 15 years ago. These are the same authors, only the IC Network is going to publish the book, and I've actually contributed a foreword and or first chapter that talks about the subtyping. So hopefully we will have this new book by the end of the year. It might be a different title, but that's going to be really, really good because it'll be the first book to ever talk about subtyping. And if you are a geek and you want the science, this is the book you're going to get. Urological and Gynecological Chronic Pelvic Pain by Robert Moldwin. This came out 2 years ago, and it is probably $125, $130. And this is really written by a doctor for doctors, focusing on caring for patients, which is really what we needed. So advanced practice nursing care for the pelvic pain patient, diet therapy in the context of chronic pelvic pain, the role of acupuncture in the management of chronic pain, phytotherapy in chronic pain, antidepressants, bladder surface mucin analogs, neuroleptic agents, anti-allergic compounds. So if you're going for the geek, if you're going to geek out like I do, then this is the book that you're going to get. Alrighty. So those are your books, my friends. Bet you didn't expect that answer. Jesse has mostly bladder pain from stage 3 endo. Yeah, that's hard. My left pelvic floor is tweaking right now. It's tweaking me. Rebecca says, magnesium glycinate is fantastic for sleep, very calming. I seem to remember somebody else asking me about that, and I seem to remember that we found a pretty significant side effect. I might be wrong, but make sure you Google it, Rebecca. Magnesium glycinate side effects. Just take a look at that, okay? Sean likes the book When It Hurts Down There. Awesome. D says, lately your hiatal hernia has gotten worse, or your IBS has acted up, and now your IC is acting up. Is there anything you can do to relieve pain? Honey, it depends upon the type of pain it is. It sounds like it's pelvic floor pain. It sounds like it's muscle pain from your hernia. And if it is from tight pelvic floor muscles, then you're going to be doing a muscle relaxant. I would look at medical marijuana. I would look at traditional pain meds. We got to get that. We got to really try to figure out the source of the pain there. Is it muscle or nerve? But the fact that it's starting with your hernia, that we focus on muscle, then your IBS started acting up. Sounds like your whole body's pretty worked up, my dear. I'm so sorry. Alexa, thoughts on elm bark? Nope, I got no thoughts on elm bark. Slippery elm bark, it's certainly been around for a while. Patients have used it. It's one of those things where you just have to try it and see how you feel. I would go for an organic brand, preferably sourced in the United States rather than China. Try a small amount and see how you do. I've never used it myself. I don't have anything to say. Cheryl Hunt, is there an IC network website for the United Kingdom? The answer is no. You have a nonprofit over there called Bladder UK. They just changed their name from the Cobb Foundation. Well, first they were the United Kingdom IC group, UKI something. Then they switched to the Cobb Foundation, which was the Cystitis and Overactive Bladder Foundation. And their website was cobbfoundation.org. And then last year they changed the name again, and I think it's Bladder Health UK. And they work with IC, but they also work with other bladder diseases, and they do have support groups throughout the United Kingdom. Alexis is asking about To Wake in Tears. She's heard that it's excellent. I personally believe that it's the worst book ever written for IC, and we do not recommend it. And we do not recommend it because, you know, I've talked about it a few times. It was not well vetted at first. And so there were statements in there that were very uncomfortable from a legal standpoint. My attorney would not allow us to promote the book. And the statement that I remember being the most worrisome was something like, I really came into my own when I started self-medicating. I had no doctor telling me what to take, how long to take it, and I was getting better. And we could not support a book which gave such, you don't say that. That's not a legally safe thing for any health group to promote. So I don't know any group, you know, in the United States that promotes that book. I'm sorry to say. I think the author had the best of intentions, but I just think that it could have been done better. You know, I'm going to take that. It's not the worst book. It's not the worst book, but it's certainly not one of the better books. I think the worst book that was written was, I have it, something about the acid alkali something. And then some of you may also know the Pink Cystitis book that was written by Larry Gillespie. And Larry Gillespie was, gosh, where is it? I think I still have it. We called it the Pink Bible, and it was available, I think, in the 70s and 80s. And Dr. Larry Gillespie was very popular down in Southern California. She was the first to really talk about diet. And so we owe her, you know, kudos for that she brought up diet. But she later affiliated with a hospital that paid kickbacks for doctors to do surgery. And she got caught up in that environment and ended up bringing in a surgeon that abandoned his practice in Utah. And they started doing surgery together, spinal surgery to, quote, cure IC, and ended up hurting a lot of patients. And she lost her medical license for it. And I know this because 60 Minutes called me personally, Morley Safer's a producer, and asked if we could help find any doctors, pro or con, that would comment on her. So quite a few patients sued for inappropriate spinal surgery that ended up crippling them or harming them badly. And then she lost her medical license, and 8 years later, she lost her medical license again. And then, yeah, there's something else in there. And then we have another doctor also in California, another female doctor who had some issues with the medical board. So I wouldn't say it's a worse book, but it's certainly one that we don't suggest. Veronica says, you're doing so well for many years. Usually do bladder installations every 6 weeks, but recently got a UTI, took macrobid, and now I just can't get it under control. I've had internal bleeding, and it's not letting me sleep. So number one, we want to make sure that the bladder infection is gone. Is it macrobid resistant? We see a lot of infections now that certainly are drug resistant. And so you would be the perfect candidate for next generation urine testing. Because this looks at the bacteria in your bladder in a very, very different way. It looks at DNA. It will tell you all the good bacteria, all the bad bacteria, as well as any fungal infections, because maybe you picked up a candida infection in your bladder from the macrobid, and that's what's causing your bladder pain. And it was our own National Institutes of Health who discovered that many patients having flares actually have candida infections, an overgrowth of candida fungus in their urine. So Veronica, that's absolutely a possibility. And of course, traditional urine testing does not search for fungus. However, next generation testing does. So it would be very interesting, in my opinion, to go have this test done, and let's see what's living in your bladder. Let's see if there's anything there that could be causing this pain. The drug resistance is real. It's happening, but so is the fungi. The fungi is real. Any thoughts on the bamboo pillow seeds? I don't know anything about bamboo pillow seeds. Sean says, does CBD oil help? Yes, it helps many patients. Rebecca says, Bladder UK is fantastic. Good. Hear it. Lisa on YouTube says, yeah, she knows about hydroxyzine dreams. They are crazy. Hello, Lisa, who just joined on Facebook. All right, guys. So I guess it's time for a giveaway. What do you think? Do you think we need a giveaway? Yeah, I think we need a giveaway. And you know what I'm going to give away today is, woohoo, the Icy Chef Cookbook. If you would like a copy of the latest book on the Icy Diet, the Icy Chef Cookbook, I need you to, hold on a sec, I got to write it down first. Okay, I need you to write a number between 1 and 100. Right now, you can do as many numbers as you want between 1 and 100. If you've won before, that's fine. You're welcome to do it again. And the first person to get this number, which I have written down on this Post-it, is going to get this book. Gina, can I name muscle relaxants for spasms? If it's bladder spasms, it's going to be ditropan oxybutynin. Nobody yet. Keep going. Some of you are 3 off. One of you is 2 off. Dottie, haha, derp. Nope, not yet. Keep going. You're farther. You're colder. Cold, cold, cold. Okay, I'm looking at your numbers right now. Oh, hold on. We have a winner. We have a winner. Kathy Vaden Tap. Guess the number 33. And if you guys, I'm just scrolling back through to make sure I didn't miss anybody. I do not believe that I missed anybody putting the number 33 in. Kathy Vaden Tap, my dear, if you would like this book, I need you to send me your mailing address. And you can do that by friending me on Facebook. I am Jill Heidi Osborne. If you can send me a friend request, or I will send, you know what? I'm going to send, hold on. I bet I can send you a friend request more quickly. I don't want to accidentally close myself out of Facebook here and screw this up. Ah! Okay. So Kathy, I can't do it right now without, I don't want to screw up this live cast, this streaming. But if you can send me a friend request, Jill Heidi Osborne, I will connect with you. I need you to send me your mailing address so that I can send you this book, all right? Because look, I already have your post-it on it with your name. It will go out to you tomorrow as soon as I get your address, all righty? I don't see, Alexis was saying that she, yeah, no, I didn't see it, hon. I'm scrolling through. All right, my friends. Well, we have been broadcasting for 2 hours and 21 minutes. I love taking your questions. I'm happy to we'll draw this to a close in the next few minutes, but last call for questions. In the meantime, my friends, I always end meetings with a very, very important message. The most important thing I want you to remember from this conversation is that this is not your fault. You have done absolutely nothing wrong. There is no shame. There is no blame in having interstitial cystitis, chronic prostatitis, bladder pain, pelvic pain, or muscle pain. I don't want you carrying any guilt. I don't want you carrying a burden on your shoulders. I don't want you to think less of yourself. I don't want you to think that you're unworthy. I don't want you to think that you're damaged goods, because you're not. You're not damaged goods. The price of life is injury. Things happen. And unfortunately, getting IC sucks because you can't see it and it hurts. It would be a hell of a lot easier if it were a broken shoulder, right? You could point to your shoulder. Go, look, it's my shoulder. You can't necessarily point down to you know what and say it's down here. It's embarrassing. But that said, there is no shame and there is no blame to injury. And I don't want you to feel that way in any shape or form. If you had a family member who was hit by a car, you would be running into the street. You would be holding them in your arms. You would be in the hospital. You would be in the ambulance. You would be at the hospital. You would be holding them as they had surgery, or whatever. They got out of surgery. You would be there putting their cast on. You would bring them home. You would get them ice cream. You would love on them like you would never love on anybody before, because that's the one gift of IC is you will never, ever, ever walk away from someone in pain. Ever, ever, ever. And if there's a gift to be had, that is a fabulous gift, and that is the gift of compassion. But, it's really hard to give it to ourselves sometimes. Some of you don't ask for it. Some of you suffer in silence. Some of you refuse to tell your family that you're in pain. Some of you, you hide it. You refuse to ask for help. You believe that you should suffer. You believe that your partner should leave. You believe that you're unworthy. And I'm saying, stop it. For God's sake, stop it. You deserve the same love that anybody else in your family gets. You deserve it. And I want you to ask for it. Okay? I don't want you to feel any shame or any blame. And think about it this way. I mean, seriously, if your child had a disfiguring injury, or somebody else had a disfiguring injury, would you want them to carry shame or blame? Of course not. You would feel sad and want to help them and support them. So let's get rid of that in our homes. Let's get rid of that in our lives. Give each other love, give each other kindness, give each other compassion, give each other support. Random acts of kindness, my friends, works wonders. When was the last time you made cookies randomly and gave it to a family member? Do it. It's a cookie, for God's sake. Make a healthy cookie. Make oatmeal cookies with raisins. You know what? Doesn't have to be a sweet, massive cookie. Make a good protein cookie, whatever. Just do something nice for each other. Okay. Every day I need you to do three things to help your body. Number one, 15 minutes. Do something for your spirit and your soul. Do something that gives you comfort spiritually. I don't care what it is. Go hug a tree if that's what you want to do. That's what I do. Go to church. Listen to Joel Osteen. Read poems. Do whatever it is that will give you 15 minutes of peace and bliss and comfort and love and support. And then I need you to do 15 minutes for your body. For that sake, take a hot bath, light some candles, put some baking soda in there or a vino in there, bring out your favorite book and just be in the bathtub for 30 minutes. You deserve it. Why not? Just no bubble bath, no chemicals. And then I need you to do 15 minutes for your noggin. I need you to do 15 minutes to improve your knowledge of IC so that you can always counteract a critic with facts. You want to get hardcore? I double dog dare you to read this book. That's hardcore fact. Man, I'm telling you, this book is a beast. But I mean, come to our website. Read a blog a day. There's a ton of blogs on there. It's like 100 blogs on there. You could be reading a blog a day for the next 3 months. Read a chapter. What I don't want you to do is get your knowledge from Facebook. Facebook is not a good source for IC information. You got to get it from other places too. The National Library of Medicine, the IC Network, the ICA. You know, let's up your game a little bit, okay? Up your game. Thank you, you guys on Facebook. Thank you, Donna. Thank you. He calls me his own. That's very, very sweet. All right. If you found this conversation helpful, please, this support group meeting helpful, please come on over to the IC Network. Why? Because you can become a member and you can get our magazine. And you saw how I refer to these in these meetings, because this is the best magazine out there, in my opinion. And we've been doing it for 15 years, very comprehensive stories on IC. And a lot of the information that appears in our magazine does not become public on our website for 6 months. So this was our fall issue. And this is the issue that talked about all the Elmeron stuff, and as well as had an interview with Dr. Angie Storr, the author of When It Hurts Down There. All righty. And the winter one will be done soon. Soon. I'm always about a month behind. Our meetings, our regularly scheduled meetings, are the first and the third Sunday of every month at 12:30 Pacific time. There will not be a meeting this Sunday, but there will be a meeting the following Sunday. Thank you, Rebecca. Joanne, yeah, I have a bad shoulder too. Lisa, carry hope in your heart, my friend. Zoe, does a vino help? Yeah, definitely. You want to take a bath in a vino? Go for it. Very calming and soothing. Why the heck not? All right. You know, I wish I could give each and every one of you a hug. You know, one of the things about IC that sucks is we tend to get pretty isolated. I'm one of those people. I mean, I've been literally, you know, caring for parents and doing IC work for quite a long time. It's hard to find your friends. It's hard to meet your friends and make new friends when you're working so hard. And you have issues with going and doing things sometimes. Like I still don't like going out to eat because I never quite know if the IBS is going to kick in. So for those of you who are feeling a little lonely and isolated, I just really want you to know that you're not alone at all, that we're here, that you've got lots and lots of brothers and sisters who have come in, and there are many, many more. And carry hope in your hearts all day, every day. Okay, everybody. See you later. Who to turn off first? Facebook, you're going first. See ya. All right, YouTube, my friends, as I get to move my screen up. Very, very nice to see you guys. Thank you so much for coming, and I wish you well, and we'll see you again soon.